tell me when. All right, well, good morning, everyone. Can everybody hear me okay? I'm glad you guys are all having great conversation. It speaks to, I think, the network of relationships of people involved in these efforts. So thank you for your time, for wearing masks, and for coming in person. We are also live streaming this on Facebook, so we're very grateful for anyone who's watching on our Facebook page. And before I say some reflections and start this process, I want to turn it over to our mayor and invite him to also say some words of welcome. So thank you, Mayor Sundquist.
Thank you so much, Amy. I appreciate it. It's an honor to be here. I think the first time I got to address this group of folks was, I can't remember if I just became mayor, I was running for mayor, and got a chance to be with you all here in this same room. And in fact, it was even bigger. I think we had more tables, more things going on. But as Amy and I were reflecting on this entire program and process, I mean, this started back in 2016, right? I was in a much different place. We had Mayor Sam Teresi at the time, who was working to try to spearhead this really, really incredible initiative. And to be picked as one of only 16 places across New York State is a really huge accomplishment. And to see now, so many years later, the number of individuals that we have served, the work that you all have done to make this happen, to reduce poverty, and to understand how we continue this work is really an incredible thing. You know, many people, you probably heard me say, I used to be a middle school teacher. So before I came back to Jamestown, I taught middle school science. And one of the things is I used to give out pencils at the beginning of every year. Now, this relates to this poverty group, don't worry. I used to give out pencils at the beginning of every year that would have my name on it so that they knew my name. But also, I had one phrase on there that I'd always start every year with, which was I told my students to be great, right? That it wasn't enough just to be fine, to be well, to do your best, right? It's to shoot for something larger, to be great in the work that you do, and to get the outcomes that you need to really make a difference in our community. And I look at this group and I think, wow, I must have given you all pencils back in 2016 to be great, because that's what you all did. You went out there, you did the work that needed to be done, you helped to serve our community, and you helped us all learn in the process on how we can continue to work together, how we can continue to fund and support programs that truly make a transformational impact in our community. And that's because each and every one of you. So as much as it's an honor for me to say thank you, it is truly an honor just to see all the work that you do and continue to do in this community. I'm excited today to learn more about the program and how we have progressed throughout the years. More importantly, just to be here with you, be here in this room with all this greatness, truly. So thank you, and I will turn it back to Amy to keep on with the program.
Thank you. So I'm going to sort of follow up, I think, on what Mayor Sundquist said, which is about thanking people and the greatness in this room. And I want to talk about who's in this room for a minute. So it is the task force, and it's the ESPRI agencies and their staff who've been doing the programs all along. It's people like Kate Ebersol, who was a consultant throughout the project. But I want you to look around the room, because so many of us have changed hats in this past sort of 5 years where we've been doing this work. When I started, I was at Community Helping Hands as part of the task force. And then I eventually went to some of those improvement workshops, those of you who were there. And I remember sitting with now Sheriff Quattrone, who was then the UCAN City Mission Director, and we were interpreting a poem together as part of these improvement workshops. And you think about a different mayor, different people in leadership, staff that have changed over, retirements that have happened. Steve Cobb was not the director of the Mental Health Association when this whole process started. I remember Kia and I, who was the director, coming up with some collaborative ideas for how we could apply for these funds. And I say that because even though we have all changed hats, even though there's been a lot of transition in the midst of all of this, people are still here and devoting themselves to the work of poverty reduction. And it shows the commitment in our institutions, in our organizations, in our government to continue this work together. And I hope what will come out of today is not just, our reflections on the lessons learned and some recommendations, but I hope you will continue to be engaged and that your thoughts about what the next steps are, or maybe how we take what we've learned and utilize it in a different format now that the Empire State Poverty Reduction Initiative is ending, but our own poverty reduction initiative continues. And so what we really want is not just for Kate and I to get up here and tell you what we've learned, but for you to be engaged. So I say that to say, as we're talking, if something resonates for you, if you've experienced it yourself, will you please raise your hand and share that? Or if you have a question as we present some of this, please ask that question, because you have all been part of just really like the group that has been a part of what's produced this final report to the community. And so your feedback and your contribution right now matter a lot. So I invite you to do that. I don't know if you had a chance to read the report. It was long. It could have been a lot longer. I will say that. But we're not going to be reading it, but we're rather going to be kind of going through kind of a high level just overlook at the whole thing, but I would encourage you to read it. But I say this because it was so critical that the agencies submitted quarterly reports. And so ESPRI agencies who are here, I want to say thank you, because, going back and reading some of those quarterly reports, especially like the last several ones where we talked about the impact of COVID and lessons learned and started to do some more higher level reflection, they made this report, I wouldn't say easy to write, but much easier than it would have been if we didn't have that. So your contribution, not only in the work that you've been doing, but also in the reflection you've been doing, has been also critical too. So thank you for that. Okay, so I'm going to start today, I'm probably have to advance that, by talking, strangely enough, about the challenges that we faced during the last 5 years. And it sounds like a little bit of a downer as a way to start, but I think acknowledging some of the challenges present in this initiative is really critical to like how we move forward, because we want to learn from those challenges, and I think they're really important. So the first one I just want to lay out that I think was a huge challenge was staff turnover. And I've already kind of acknowledged all of the change in leadership, but every single ESPRI agency had staff turnover. Actually, even JCLC did. Every single one had either leadership or program staff turnover, and in some cases both. That was a huge challenge. Those of you who are in leadership know how challenging it is to onboard new staff to even like the program and their work and their responsibilities and even the culture. But also there's the challenge of data collection. And so oftentimes you're not only onboarding your staff to what they're going to be actually doing, but the data, the way we collect the data, the importance of data. And so staff turnover really impacted a lot of our ESPRI programs because there was a gap sometimes in knowledge. There was a gap in understanding the role. We even experienced it at a United Way. We had 3 directors of community impact during the ESPRI initiative. That's difficult, when that's 20% of someone's work, to like onboard them and have them really like in a really like strong way able to do their work. So it's a challenge that as a nonprofit sector we have to really consider. And I know it's not just the nonprofit sector that deals with this, but if we know that some of the things that work, and we'll get into this, are things like coaching and mentoring and authentic client relationships, that is very difficult to accomplish when you have a lot of staff turnover. And that was a big challenge. Another challenge was charity tracker. So it was kind of both a pro and a con. So Charity Tracker, and we'll talk about this, was this shared platform for sharing information. It allowed us to produce numbers like we've talked about, where we know the unduplicated households. And so, each agency was reporting information to us, but they were also entering information in Charity Tracker. And so we knew if someone was working with 2 or more agencies, and so I could pull reports that would show the unduplicated households. However, one of the challenges of Charity Tracker was entering that data in the same way. And then also when we were designing Charity Tracker and designing how it would work, it was very difficult to design a database when we didn't exactly know how the agencies would function and how they reported it. And so I sort of was joking with Krista a little bit when she came in, because she and I were the ones that sort of put that together and shaped it and made sure we had all the right fields that we needed to have, like how differently we might have designed Charity Tracker if we had known what we know now. And but on the other hand, I think it's an important component and critical moving forward when we think about shared information database, how it is that agencies can more efficiently and effectively communicate and collaborate with each other. But it was difficult to set it up not knowing what the thing would be before we started. The second thing, let's see, another challenge. This isn't a challenge, but it's sort of like things I wish I had done differently. And I'm just being very, I think, transparent with all of you. One thing I think we could have done better at is including the voices of those with lived experience in poverty. That was part of the planning process, and there were some challenges with that, but I don't think that we carried that forward well enough. And that's something that I think moving forward, continuing to make sure that we have the voices of people who have that lived experience in poverty is really, really important. It's also a component of equity and inclusion when we start to talk about equity and inclusion, and we'll talk about that going forward too. And then finally, when I talk about challenges, I think a challenge and something, again, I wish we had done differently would be to have hired a project director for ESPRI, even if that person was part-time. And there were 16 localities that were chosen for this Empire State grant, and every single one hired a project director except the city of Jamestown. And I don't know how that would have worked with the funds. Less funds would have gone to the programs. There's all kinds of challenges to that, but I think that we could have supported the agencies better if we had a project director, even if it was part-time. I think we could have navigated better some of those challenges of staff turnover if we had had a project director. I think Charity Tracker would have been better because we could have done more training, so our data, I think, would have been better. Although, and this is the final challenge, but COVID really did a number on the data too. And that was a challenge that we could not control, but it certainly impacted, and still continues to impact many of these programs. So that's just something, again, moving forward as we think about recommendations or maybe how we continue this work. What does it look like to have it be not just 20% of someone's time and responsibilities, but maybe full-time or something that's closer to full-time to really support the work that we're going to talk about when we talk about lessons learned. And then the final challenge, which I already kind of mentioned, is the impact of COVID. I don't think we need to belabor this point. I think we all know by now COVID's bad, and it really affects our ability to do our work. Chris Schuyler's like, yeah, it's like, and but certainly when it came to following up with clients, it's this transition to virtual and being able to connect with clients and know whether or not they were employed. When it comes to things like employment, so some of the main goals of ESPRI was for people to secure employment or to enroll in educational programs. Well, people lost their jobs because of COVID. People got unemployment because of COVID, so their incomes were very different than what we had thought. And so a lot of the ways we were measuring our impact and knowing whether we were being successful, COVID made that really difficult to know whether or not we accomplished what we set out to accomplish. And I said this in the report, and I've said it to the data and evaluation team, which I will also acknowledge right now, who have been incredibly important to this process. We have met almost quarterly to review the ESPRI reports, to talk about things like this report. They've been the most active group, I think, in the task force, and COVID also impacted this task force. All of a sudden, thinking about economic development work as a subcommittee fell a little bit to the bottom of people's priorities, Same was true with policy implications. We were all really just so engaged in doing our day jobs that kind of higher level work became impossible. But the data and evaluation group continued to meet and do the work that they were supposed to do during COVID. So I just thank all of you, and that's Linda and Tori and Bruce and Cecil and Anne, and am I missing somebody else? Bree, she's not here today. Amanda Giesing from the YWCA. So it was a group that continued to look at a higher level in spite of some challenges that we were all facing. And I think it's important to acknowledge their work, not only in this report, but in the entire process of this initiative. So anyways, COVID was a challenge and continues to be a challenge. On the other hand, and this was also, I think, stated at some point, because of the culture we had developed with ESPRI agencies around collaboration and around Pdsa, which again you'll hear about, I think those ESPRI agencies were really well positioned to adapt, to be very flexible, to work together a little bit more than it would be very easy to silo, I think, during those times when you're in crisis mode and just simply trying to kind of survive and serve your clients. I think that they were just maybe slightly more well positioned to do that work than the average nonprofit, let's just say, because of some of the work that had already been done. So it was a challenge, and yet I think all of you have been just navigating that extremely well. So thank you for that. So I'm going to pause for a minute because those are challenges, and questions and comments from the people here, knowing that I want you to make a contribution and put your 2 cents in. Okay, so again, you have the report in front of you. You can go to the next slide, but we're going to talk about really quickly the lessons learned. And these are in the report. And I'm going to talk a bit about collaboration. So collaboration is a word that we use all the time, and yet is very difficult to do in spite of how much we talk about it, use it, ask you to report on applications. And I think part of it is that we don't have a very good definition of collaboration. And this continuum that you see here is part of that. So when we think about collaboration, most of the time we're thinking of networking or coordination or cooperation, but true collaboration, I think, is pretty difficult to achieve. And so, yes, collaboration is critical, but what we learned in ESPRI is that having an agency like the United Way or some hub organization to actually structure the collaboration was important. And so what that looked like was, yes, the charity tracker, so that was important, a shared way of reporting information, but also we had monthly meetings. And I am sure the ESPRI agencies and the staff here will tell you that they were probably really annoyed by these monthly meetings at times. And the monthly meetings varied in structure. Sometimes they were kind of more along the lines of professional development and training. Sometimes those meetings were what I called sort of affectionately unstructured playtime. And so just time to network. There was no agenda. It was just kind of simply sharing information. Sometimes it was reporting information. Sometimes it was asking someone to share a challenge and then people problem solving. But the monthly meetings were also important in overcoming that staff turnover issue, because the new staff would come into this meeting where there was some consistency of culture and some consistency of relationships, and I think it was beneficial as they were kind of onboarding. And I'm looking at the Resource Center, and Josh, who has literally only been on staff 6 weeks, 2 meetings. He's been on staff for 2 meetings. But I hope that being a part of even those meetings has helped him begin to understand some of the work that he is doing, in partnership with the Resource Center as one of their newer staff for SAFER. So collaboration was critical, yes, but structuring it, in some cases mandating it, and being very intentional about it was the most important piece. Any comments or questions? Okay. Second lesson learned was flexible funding. Now, you've heard us maybe talk a lot about this. This has come up many times. But almost every agency had what we eventually called flexible funds. Initially, we called them emergency assistance funds, but essentially a kind of pool of money where if there was any barrier to someone getting employment and enrolling in education, they had the flexibility to do whatever they needed to do to overcome that barrier. And instead of us kind of pre-setting the kinds of things they could use it for. So that was everything from car repair to getting a driver's license to getting a birth certificate. You know, the cost of a birth certificate went up in the last 5 years so that they could get a driver's license, you know, to gift cards, you know, for Uber in some cases. But that flexibility of funding delivered within the relationship that was a coaching or mentoring or some kind of support staff was really critical. And we had to give testimony to the State Assembly Committee on Social Services, and Andy was there. And that's one of the things that our locality gave testimony about was the importance of flexible funding in overcoming what was usually a very small barrier. You know, I would say the average sort of amount of money spent per transaction was probably less than $50 or somewhere between 50 and 100 might have been somewhere in there. It wasn't a lot, but for the client and the participant, it was huge. It not only helped them sort of get the next step down the road, but it also helped them to feel very, very supported by the coach. It helped develop that relationship. And so ideally, they would solve that short-term problem while then kind of brainstorming and strategizing with their coach how to come up with a more long-term solution to how do I get to work. But it was really critical, I think, and also what I would consider one of the best practices of this ESPRI initiative. Any questions about flexible funding? Liz? Yes, and I should have said that, and so I thank you for saying that, because we use that model then and there was a group of funders, you know, involved in the Chautauqua County Crisis Response Fund to give flexible funding then to agencies, both in North and South County, expanding it, but using all the same parameters and kind of documentation that we had used in ESPRI. And ESPRI agencies sort of got that funding immediately because we knew they knew how to deploy it, right? And they had been working in that space already. And so again, it kind of shows you like we had developed these practices that ultimately were useful even in the midst of a global pandemic where we couldn't have known what that was going to be like for us. So thank you. Other questions? Did someone else raise their hand? I didn't know. Okay.
The reason we're using the mic for the questions is because that's how being picked up on the live stream. So without the mic, they won't hear you. So it's not so much to do talking to the mask.
It helps a lot. And then, okay, and I've mentioned this already as another important lesson, but, you know, the critical role of mentors and coaches. This is not rocket science. I think all of us who've been in the nonprofit sector and been working, you know, in human services know that the relationships are often what helps people make a change, overcome a barrier, change their life situation. Like that relationship and a really authentic relationship is really important. So that's not a new lesson learned, but I think we would be remiss if we didn't make sure that was highlighted as an important component. And I think our ESPRI agencies would say this and had said this multiple times in their reports, that the relationship they had, and it varied sometimes, and it was very intense. Sometimes, you know, depending on the client, depending on the program, sometimes it was simply like making a connection and a referral and a linkage that they didn't know about before that really changed some of their circumstances for them or their families. But that relationship was really important. So like developing relationships was important. And whether we knew it or not, in those community improvement workshops, the very first one, where Jim Catrone and I were reading poetry together, that was something called Habits of the Heart. And part of what it was designed to kind of just develop and make people aware of was how critical, like seeing people for who they are and really looking at them as human beings, how important that was in any work that we're doing. And it's easy to lose sight of that when we have a lot of clients, when we're serving a lot of people, when we're busy, when we're stressed. But taking that moment to pause and see every person, as a fellow kind of, sojourner in the work and in life, was part of what that first community improvement workshop was about, and part of what made a lot of these programs successful. And related to that is this idea of a holistic approach. Again, not rocket science for most of us, but authentic relationships, a holistic approach, understanding that it wasn't just you need to get a job. It was, there's this happening in your life. There's this happening in your life. This is also a challenge. And it was sort of like a network of issues and problems and barriers that was contributing to the fact that they weren't able to get a job. And so that coach with the authentic relationship was able to help them navigate multiple barriers and multiple systems sometimes and services, because they were taking a more holistic approach within the context of the relationship and had the tool of flexible funding to help them in that process. So I'll pause.
I have a couple of questions, just because
Microphone?
I'm Tamu Reinhardt.
It's on. Yeah.
I'm Tamu Reinhardt. I work for Jamestown Public Schools, and I'm in a very different position than I've been in the past. And so, just a couple of questions, because I'm just doing some fact finding at this point in time. But it's wonderful to see that the agencies all collaborate. It's very exciting. I guess what I'm trying to figure out is, was the school district either shared with or involved or a part of any of this conversation? And the reason I ask is for a couple of reasons. A lot of the families you work with have children in the school district, so it's helpful to know that, and I'm working with the schools on equity policies and things like that, so it's helpful to know if you're working with families who are trying to overcome some of these very small but in their life significant challenges, that we know on the district side, so we're not hounding a parent if they can't get their child to school. It's those type of things, or just some of the, or what you're working on with a specific family, so we can adjust accordingly in the schools, as well as how we work with the agencies with the funding that we provide, because we have grants and things that we are doing as well. And so, in the future, or if there's any way to do that, I kind of see the school district as like almost like the backbone of a community. Most everybody here has gone through, or most of the families, at least that you work with, have gone through our school system. And so we're really trying to work hard to address some of the issues that families are facing now and have been facing in the future from at the kindergarten level. So the products we're putting into the community are people who have a skill set, who can read and write well, and who have all of the things necessary to put all of you out of business. So that was a joke. I'm gonna need you to but to really make sure that we, from the school district perspective, are working collaboratively with the agencies. So what you're working on, we can support during the day with either families or students who might be struggling with some of the food insecurities and things that their parents see as stressors, because that comes into the schools, and that affects how a child interacts with the schools. That affects how a child gets their homework done. That affects behavior. And so I don't know where this is going forward, but in any way that we can either work with this group or with the agencies collectively, I think that would be a huge win.
So I have two responses, one about the past and one about the future. So the past is that, yes, the Jamestown Public School District was always a part of the planning in this, and in fact, originally was one of the programs. So Jamestown Public Schools was awarded funds for ESPRI in partnership with Chautauqua Works to do a youth work program and have a coach, an employment coach, embedded in the high school. And so that has been all along a component of this. And you're right, 100% that most of the families that we were probably working with had children in the public schools, because the city of Jamestown, this is what this initiative was about. Now, for the future, I would die a happy death if we had some kind of shared system so that the agencies also knew something about what was happening with a child in school. And I know that our United Way community partners would love that. It would make their job a lot easier in terms of data. It would also make the school district's job a lot easier to know what other kinds of supports are existing for that family. But that has not been accomplished yet. Okay. Thank you. John. Oh, sorry. You didn't know you were getting your workout this morning, Father Luke.
So on that note, some of our interns at JHS were paid through ESPRI.
Mm-hmm.
We gave them job skills, banking skills, and 2 of those interns became employees.
Mm-hmm.
So what a great way to work together, teach finances, teach job skills, and then bring them into the workforce.
And, and this is a great point, John, to talk about collaboration as well, because when we talk about collaboration, it wasn't just interagency collaboration. We also did some collaborative work with financial institutions like Southern Chicago Federal Credit Union. I think, some of you and some of your staff came to some of our meetings because there were so many services and products that you offered as a CDFI that would help these clients build their credit, like get a loan for a vehicle when they would probably not qualify for a loan at any other financial institution. And that was a really critical component that came up a lot. JCLC and the Resource Center, you guys were constantly connecting your clients to the services of Southern Chicago Federal Credit Union, and your services were more successful because they had the support of the agency. They were more likely to pay back a loan because you knew that they had the support. So there was this, and this is a word that I'm stealing from Rosary Kalivas, the former executive director at JCLC, but there was like a collateral benefit to the fact that I think you came to 2 meetings. But those relationships got developed and awareness of programs and services that I would venture to say were not present beforehand. I'm getting kind of some nods from people. So again, that was a component of collaboration that was beyond just nonprofits collaborating, but cross-sector. Oh, and one more thing, sorry. And I'm going to turn it over to you for a second, John, because you also developed new products that you didn't have before and programs available to clients because you began to understand the clientele better yourself because of your relationships with ESPRI agencies.
So this really is an opportunity to manage risk rather than eliminate risk. Some institutions don't want to take any risk on their balance sheet, whereas we believe that when these individuals are getting, especially the families, getting support, that helps us manage the risk and allows us to take a deeper dive into some of the most risky individuals.
Yeah, and I at some point maybe we'll have you talk about some new programs that are just brand new, but really designed for Alice families, for people in poverty, to build credit. A great revolving loan program that you are beginning that I think I would venture to say, if it were not for ESPRI, I don't know that you would have developed them. Maybe you would have, but I think that it was sort of a catalyst to what you were already doing. So thank you. Okay, I'm going to turn it over to Kate. She's going to talk about applied improvement science and engagement.
Yeah, good morning, everybody. My role in ESPRI over the past 5 years initially was to conduct the community health improvement workshops. They were, they were based on work training that I had received through grants from the Robert Wood Johnson Foundation. And Amy already touched on the importance of the fact that when we look at improvement science, when we really look at how are we improving our community, are we making a difference? There is the hard data, whatever you can grab, but there's also the soft side that Amy referred to a few times, which is the human relationships that need to be built in order to be successful in these kinds of initiatives. I will also say, as I lead into my graph that I'm going to show you, I personally was so grateful for the input of the evaluation team. They were just, for somebody who was trying to work with the United Way throughout the years to say, how can we measure the impact of this initiative? The ideas, the thoughts, the suggestions were critically important. Sometimes the questions were like, how are we going to do that? And yet they inspired us to try and figure out how do we at least make an attempt to measure impact. One of the graphs that we came up with as a result of that is one that when I first put it together, Katie Geis looked at it and said, Kate, I have no idea what you're saying. And I took that, and then later I got feedback from others that said it's just too confusing. So I've revised this. We're going through this rather quickly. But one of the questions was, do we know what it takes to really make a difference? Have we measured how much of an intensity of engagement does it take to really make a difference with people? And that's what this chart shows. And basically, if you can read it, okay, low engagement. And by the way, the agencies themselves rated every client they had. They went into Charity Tracker and they said, these are the clients we've worked with. How intense was the engagement with that client? And how many referrals did we make for each client? So you have engagement, level of engagement is what's being low engagement, low referral, or high engagement, high referral. And then the impact enrolled in educational programs, and especially we're looking at secured employment or retained employment, because that's what we are really trying to aim for in this program. What we found out when we did this was obviously when you have very low engagement and low referrals, you don't get much, right? 156 clients had medium levels of engagement, medium levels of referral, and in terms of securing, retaining employment, they were the most successful group. We found that especially interesting when we looked at these three, which were all high engagement and different levels of referral. None of them were as successful as the medium level engagement. What it speaks to is to go back to what Amy was saying about the holistic approach, the coach, mentor, call them what you will, creating relationships with people and really understanding their readiness to change. So if they were really ready to change, they didn't need this. They didn't need this high level. Actually, if they needed that high level of engagement, they probably weren't ready to change yet. It was more the coach or mentor pushing them along rather than them taking responsibility to say, I want to have a change in my life and I'm going to take responsibility for it. And I think that's what the data ended up telling us as far as this. What it informed the agencies of was to say, hey, sometimes we need to take a look at this whole idea of readiness to change and say, we've got to gauge that, and if we're just pushing, maybe that's not a person who's ready to change. Maybe we need to look at a different way of working with them or something. So back to, and by the way, any questions on this? I know some of you may be saying, Kate, I don't understand what that means, but hopefully I have revised it enough it makes some sense. All of this was part of the data collection process. I said early on in the program during the community improvement workshops, and I was quoted on it, and I forgot I'd said it, if you can't measure it, you can't manage it. I will say there was quite a few things that we were trying to measure through Charity Tracker, through the quarterly reports from the agencies. I think we were very successful in capturing some. I know one area we were not successful in, and one that we really wanted to have more of an impact, was financial data. And that basically we learned over the years that the clients we were working with didn't want to share their family income. They didn't want to share how their family income had changed. It was a very difficult piece of information to get out of them, and as a result, we don't really have a real true body of data to look at as far as impact of ESPRI on things, policy things, such as Amy will touch on, like the benefit cliff. I will also say, though, part of the applied improvement science workshops also taught a number of things such as aim and driver diagrams and Pdsa cycles. And I would say of all the things that we taught from a pure improvement science standpoint, Pdsa cycles were probably the ones, whether they did it consciously or not, the ones that the agencies used the most. And one of the areas they used it in was in the recruitment process. we saw where, I'm thinking about TRC, I'm thinking about JCC, where they tried certain ways of recruiting people into their program. They didn't work. So and for those of you that don't know PDSAs, plan, do, study, act. Plan to do something, do it, see what happened, and then act. Either do more of it or do something different. And that became a regular process for these agencies in a lot of the things that they did. Like I say, whether it was articulated as, yes, we're doing a PDSA cycle, or whether they just did it naturally as part of their efforts to be successful in their programming, they saw how well things were working, and they made the modifications they needed to make on the fly, if you will, to continue to try different things or do more of what they had discovered really did work. And so my little data heart was so happy to see them all using applied improvement science in terms of PDSA cycles and tools like that, and especially in the recruitment process. And we might touch on that. We're going to do a panel discussion in a little while. We may touch on that. We'll see where it all goes. I'm going to leave it up to the people I'm going to be working with there. But I want to turn it back over to Amy. But before I do, any questions on the data side, the community health improvement side of this whole project? Okay. And I do want to say one more time, thank you to the lovely brains that were in that data evaluation group. Could not have done a lot of what we did without them. I want to give a call out to them again.
So about probably 2.5 years into our monthly meetings, and not that long ago, we had several meetings that were simply about not the programs, not the micro, but what are the systemic issues and systems that are keeping people in poverty? And what have you learned from your clients? What have you seen from your interactions? And so we identified 3, and these are in the report. One was the complexity of navigating the system of services. That was simply a huge barrier for anyone who found themselves in need of support. And it was often actually a huge challenge for the coaches and the mentors themselves to navigate those. We had I remember several reports of Melissa's reports. Like, she literally had a section on all the things I learned this quarter. and it was things like what it costs to get somebody a driver's license, what program or service was available through what other agency or government program. But frankly, it was a really complex system to navigate for someone who had a lot of tools, like a coach or a mentor, but someone who was in poverty themselves, it was near to impossible. Or not even just poverty, but in Alice's family. So working in need of support, but navigating that system was incredibly complex. And that is something that needs to be addressed. That is, I will just say, from the standpoint of a recommendation, something that we should be looking at in the future, because it was a huge barrier. The second thing that came up a lot for people was the benefits cliff. And again, this came out of not just us sort of on this sort of philosophical level talking about the benefits cliff, but it was from the stories of people that these agencies were serving. They were turning down raises. They didn't want extra hours at work. And because it put them in a position where they no longer qualified for some key benefits. Came up over and over and over again. Now, this is a true policy issue in the sense that there's nothing that we can do at a local level to change the policy or how someone qualifies for benefits, but it was certainly impacting people's ability to be successful. Now, we throw up this graph, which is in the report, and if you look at it closely, you can kind of see that somebody who's making only $15,000 a year, which is definitely below poverty, is actually in a better position than someone who is making $55,000, depending on like their family structure and size, if they are getting subsidies for childcare, if they're getting health insurance, if they're getting help with HEAP, SNAP, all of these programs that are designed to be a really effective support system. And so people are making choices every day to not be employed because, frankly, their family is sometimes in a better position, and they have to make these choices, and they're difficult choices. And many, many stories. In almost every single report, we asked for what we called a success story or a challenge story. Many stories came from these reports of people having to make decisions like this. And so this just illustrates, again, it's kind of a conglomeration of a whole bunch of charts and graphs that we took from all different places to kind of illustrate the impact. But the benefits cliff was certainly something that every day clients and participants were having to navigate. I'm going to pause about that. Any comments on the benefits cliff? John, please.
From an employer's point of view, not understanding that, and you reach out and you hire somebody and bring them on board, and suddenly they're sick, they won't take an extra shift, and they don't explain it to the employer, then we look at them unfavorably and probably end up terminating them eventually. So to get that word out both to the families and to the employers, then we can design the appropriate schedules to create success.
And Beth and or Terry, I believe that, so because you were working directly with employers, I think there were some situations where you had conversations with employers to help, or the HR department, to help them understand why the person you were coaching was not taking like that shift or the challenges they were facing. Is that correct? I think I remember. And so you were sort of an advocate at the employment site for your participants, and then also like providing a lot of education as well to employers to understand that there were greater sort of policy and systemic things at work that were contributing to what looked like a very personal decision for someone. Do you want to? Yeah.
Yeah, I think that it's important to navigate that because the employers just get frustrated. They don't understand the complexities of the decisions that families are making day to day. And so to break that down and be able to explain why somebody would be turning down overtime or turning down working an extra shift for a pay raise. I know employers that like kind of boggles their mind why somebody would turn down a 25-cent pay raise. But a 25-cent pay raise could have financial implications for a household of thousands of dollars coming in. So, you know, there were times where, you know, Beth was working with somebody on budgeting and figured out that they were going to have to quit their job because of a transportation barrier. The cost of transportation was too much. And so they figured out if she could work one extra shift a week, that would be able to allow her to pay for her transportation and continue working and not lose any of her benefits. And so like navigating that. So it's a balancing act because you're trying to support somebody. You know, we would love everybody to just be able to work full time and not rely on some of the services that are available for them. But the financial implications are just too much for somebody to be able to give up. And they have to understand that before they make those decisions. So sometimes people, it's coaching for the businesses and the employers, but also the people that we're supporting so that they understand what the decision and the impacts are before they make them. So I think when we went into it, our original like pie in the sky was we're going to get all of these people to a sustainable income in 18 months and, you know, life is going to be good. And we very quickly learned that there are so many other implications there, but getting those employers to understand the businesses that we worked with were so much more willing, I think, to work with the employee than not. You know, that they can hire 2 part-time employees instead of, you know, kind of carving that out a little bit. But it was definitely took some time because employers initially just get frustrated because they have needs that need to be met, and it's a difficult balancing act. So I think that's an area where we only work with 14 businesses, right? So there's a lot more opportunity to bring that out so that employers understand some of the very difficult decisions their workforce is facing every day.
And so there was a subcommittee of both ESPRI agencies. It involved Chautauqua Opportunities. It involved Chautauqua Works, where we started to sort of work a little bit on the benefits cliff and more so, and we're in the process still of developing this, but like a resource guide that was sort of almost like a 1 sheet or maybe 2, because it gets complicated quick, but that would be directed for employers or for case managers to help them understand. And one of the recommendations that shows up in the report, now we can't change policy, and we can do advocacy, and we can have conversations with our elected officials and that sort of thing, and that's all important. But one of the local things that some communities have done and might work well here is a benefits transition navigator. Literally somebody who does exactly what was happening with the resource center and helps someone, or training of existing navigators or coaches to help them understand and be able to understand the impact that a job change or a promotion might have on someone's financial situation. So that's something that is still in process of developing, but we feel like could be, a real sort of positive outcome of ESPRI, that we have maybe some resources out there. And ideally, like in the ideal world, you might have something that's a website you can go on. I mean, I can go to any number of websites and calculate my future retirement income with no problem. There's many websites that will gladly help me with that so that they will get my future retirement income as well. But where can I go to type in my income, type in the job change, and show me what's the magic number that I can make and still get these benefits? Or how much do I have to make where my sort of household situation is going to be better off than when I had that? Steve. Oh, sorry. Wait for the mic.
So as the director of an agency, this chart impacts me greatly, because a lot of the agencies that we're working with ESPRI, I would consider us helping agencies, helping nonprofits. And the fact that I know at the MHA, I can't pay most of my staff a salary of $55,000 a year to even come close to a value benefit that's equal to somebody who's earning $15,000 a year. And that impacts our staff greatly. It impacts our ability as an organization to have staff who have the qualifications to be there to coach these the participants who we are working with. And while that isn't something we directly address in ESPRI, I think as a society and as a community, we need to think about that and address that. Our staff, my staff, the Resource Center staff, JCL staff, we're the frontline workers who are supporting these people. If we crack and start to fall apart, that's going to have a huge, huge impact on our community. We say that we have these, and we do have wonderful resources here in Chautauqua County. But how long are we going to be able to continue to do that if we don't value, as a society, the coaches at the MHA, the coaches at the Resource Center, the teachers at JCLC? And I know there are other organizations here too, the Community Helping Hands. If we're not able to value and compensate and take care of our community members who are frontline workers, we can be very proud of the advances we made at ESPRI. We've done some great things, but it's a dynamic that's not sustainable.
I think that is an excellent point, and that has been present all along. When we talked about Alice families, I think outside of probably the executive leadership of nonprofits, they are all Alice families, right? Which is basically barely making enough to get by, and one crisis away, usually, or two, from potentially being in poverty themselves. And that staff turnover issue that we talked about as a challenge, you're losing staff to the county government, to the school districts where the pay and the benefits are better. And that makes it hard to do your work. The best thing nonprofits have going for them is they probably have people who truly believe in their mission, and that's why they're willing to take a lot less money for probably sometimes at least equally challenging work, depending on the situation. And that is, it's not included. It's sort of subtly embedded in this conversation, but not called out specifically in the report. But I think it is a reality to contend with as a community when we think about how we support not only people in poverty, but the people who are the care coordinators, the coaches, the case managers, the navigators, all of those people. Very, very good point. Anyone else? One final policy implication and then we're going to switch over to doing a panel discussion, is the issue of equity. And so, again, present all along, and in fact, one of the community improvement workshops that was a precursor to even applying for ESPRI funds was specifically on using an equity lens in your programs, in your evaluation. And because we know from the community needs assessment that people of color in the city of Jamestown, but also beyond that, are disproportionately affected by poverty. And so that's something that was, again, like a systemic issue in terms of access, I think, for clients, sometimes who agencies were serving. And another one that I probably should have said at the beginning, which is something that I wish we had done differently, is continued in a much more intentional way, like looking at, like utilizing an equity lens in, like talking about it in our monthly meetings, calling it out when we like did reports. You know, you'll see in the dashboard that we've utilized all along that we call out the demographic information, which is great, but I don't know that we ever did anything with it. And I think that's incumbent in the next phase to make sure that we do not lose sight of the equity issues that are systemic, which contribute to people being in poverty and struggling to get out of it. So I say that because I think it's an important one to call out as well. Any questions or comments at this point? John.
So I'll shorten the story as much as I can. We had a gentleman, non-English speaking gentleman, that we helped build his credit. Hardworking guy, great guy. He went out to buy a new truck. He got financed. The dealership set him up. I'm not going to mention the dealership's name. Dealership set him up, sent him to Santander at 19% interest. He was B paper. He qualified for 9% in my shop. The dealership encourages you to just stay there. So fortunately, he came into one of our branches, the loan officer that he had dealt with, saw he was driving a new vehicle. We refinanced that vehicle for him at 9%. We're giving him the tools to get to A paper. We will lower his interest rate when he does. We're saving him $12,000. That's $12,000 in his family's budget.
Mm-hmm.
That should stay here. So education, we need to let everybody know, your agencies and everywhere, that a lot of the people are in that lower category. They don't know the resources available to leave more money in their pocket.
And again, you know, part of the systemic issues that wasn't necessarily called out, but predatory practices, not just, and I remember Melissa sharing a story of how much somebody paid for a cell phone. It was an astronomical amount that they ultimately ended up paying for a cell phone when they had very limited income. And so I think it's part of why it's necessary to keep meeting and discussing and calling out some of these, because that's how we learn about that kind of thing. And then hopefully come back and pass it on to how we're delivering services or resourcing and linking clients. So.
Just one thing, I want to thank you for what you said, because this, with communities of color and non-English speaking communities, this is a real thing, not only with financing for cars, but mortgages, et cetera.
Mm-hmm.
And so that kind of hit me right here, because it's very something that happens to communities of color very often. So excuse me for a moment. But so I would really encourage these agencies who are going to start working with families to really look at some of the systems of equality that have put people here in the first place. And I know it's a polarizing topic, and I know that some people don't believe it happens, but if you talk to some of the people in your agencies who come from marginalized school district, different agencies are working with different schools and different families. And so we don't even know who does what and who has what. So that's just something I would encourage us to kind of maybe pull out, dust off, revisit, or something like that. But thank you.
Thank you. Sean.
Well, just real quick, I wanted to say, because you mentioned real quickly about the benefit split and the state level, and then it just kind of faded away. That's extremely important, I think, for every single person in this room to come together and push for. To our state representatives, our federal representatives of this area, nothing is going to change until that gets changed. Having the navigators to help people figure it out is great, and that can help people, but they're not going to get ahead until those numbers change. The most they can get for a single person is $350 a month for rent. That's insane. It's insane. So I think if we've learned about that through this, that is something we really have to push hard.
Thank you for saying that. It goes to that story that I know that all of you are very well aware of somebody who's pulling somebody out of the river, doing a great job, working hard, saving tons of people. And at some point, you're like, why are so many people falling into the river in the first place? There's a problem here. Let's go upstream and fix it there and not spend so much energy downstream, saving people, which is important, but, fixing what's causing the issue in the first place. Okay, so we're going to switch over to a panel discussion, and I'm going to invite Sean and Beth and Melissa and Wendy up here. And you'll notice that all of these folks are not the executive directors of the agencies. We thought it was important to have kind of a conversation with some of the frontline staff and let you hear directly from them some of their challenges and things that they've learned, I think, in the last few years. So I think you guys just kind of pass this mic back and forth.
Sure.
Turn over to Kate.
All right. Why don't we go down the row and introduce yourselves and what you do?
Hi, I'm Beth Germain. I work at the Resource Center, and I'm a success coach there.
I'm Sean Jones. I work at the Mental Health Association in Chautauqua County, and I'm a certified recovery peer advocate.
I am Wendy Lisinski. I work at Jamestown Community College in support for our Single Parents Reaching Education to Employment program at the college. My role is an achievement coach to provide success for all single parents who are taking courses at the college.
Hi, my name is Melissa Malber. I work with parents as teachers at JCLC, plus linkages to success with employment and education goals.
Great, thank you. So I want to, make sure we hear from everybody, and we've got a number of different questions. First one, we'll just start off with you. You're holding the mic, Melissa.
Okay.
So, what works best for you in working with your clients?
I think, there were a lot of factors. Having time with the family, so I always felt like quality time, maybe not quantity. So I had a rather small caseload. But I would see the best results often with families that I did spend the most time with. If they entered my program with a great number of barriers, obviously I didn't have the expectation that they would be out of poverty and transformed into this new life in a matter of, say, 6 months. So I did have the luxury of working with a smaller caseload and working one-on-one, spending a great deal of time with these families, overall encompassing all kinds of referrals and resources. Our program is multi-generational, so I would work one-on-one with the child and the family, but also help the mother and often impact the whole family to reach their goals. So it was nice to have that time to really help them achieve success. And we did. Constant encouragement and praise. You can do it. Motivation, cheerleading, checking in, listening, not just saying, okay, I'm going to refer you to this agency or I'm going to send you here for this support. Although we did that often with our neighbors in our community. Listening, because everybody that I work with is in poverty. And I had to understand that when they came into my program, they were all coming from a unique individual perspective. So understanding that was key for me because, well, part of my job is to talk about something like routines. So with the PAT curriculum, I'm talking about routines at a home visit with a family. That looks very different to a family that escaped domestic violence and is couch surfing, as opposed to a family that, you know, the child has their own bedroom. So I had to really put my biases aside and approach that family from where they were coming from. So that's a few examples of what worked for us.
Okay, great. Thank you, Melissa. Some really interesting concepts there. Time, listening, and really understanding their perspective, if you will. Great. How about you, Wendy?
Thank you. Similar to Melissa, you know, the most important aspect of what I can do for single parents who are typically the first generational individual who is coming from their family to attend higher education, oftentimes lacking familial support outside of the college, knowing exactly where to go and who to go to in order to process specific tasks to enroll. Upon enrollment, I've worked very closely with our admissions department, and so we are able to connect adults who are coming into the college. My immediate contact is a phone call or to meet them in person, which really truly does make a difference in one's lives. Being able to provide intrusive relationships have really made an impact, and it's great to provide a space at the college for single parents who I typically hear feel very out of place at a community college, you know, and they're oftentimes very timid to even acknowledge to their professors or classmates that they are a parent at a community college. And so it's very nice to provide a space at the college where they have someone to come and talk to, oftentimes to vent, just to hang out. I often have single parents working in my office, providing workshops for financial literacy and career readiness and so on. But overall, it's knowing that someone is going to be there for them and checking in on them to make sure that they're feeling well supported while they're at the college. And that means on campus, but also off campus. I also want them to feel supported, you know, throughout the community, that they do have somebody to turn to if they have questions or concerns, or if they're lacking basic needs, transportation, they have someone that's coming in to check on them daily.
Yeah, again, the relationship piece, and interesting, you mentioned time, you mentioned space, that both of them are critical components. Great. How about you, Sean?
Well, so I'm just kind of new to this because Sheridan Smith, as we all know, was the main person for ESPRI up until about a month ago. But I mean, I still, you know, observed everything that was happening at the MHA with ESPRI, and I was involved a little bit here and there. But I mean, I think it's just, this was able to give us just other ways to help support all of our participants. It opened a lot of doors for our people to be able to make those connections throughout the community so that we could better serve them in a faster, more time-efficient way, I guess. Yeah, I mean, it was just, it just opened a lot of doors for us, I think, is the best way I could explain it.
Great. And by the way, thank you for speaking for Sheridan.
In our SAFER program, it's really kind of everything that everybody said, but I think having the resources available so that we can make things doable for people, you know, kind of meeting people where they are and having supports in place to help them take it in the chunks that they can deal with at the time. The other thing that worked really well is being able to respond quickly. The flex funds came into effect, a lot of that, that we can take that initial worry off of somebody. I got an email just yesterday, actually, from somebody who works at one of our member agencies, and she doesn't have enough money to get to work for her gas because she's been off on an unpaid medical leave since mid-August, and it's time for her to go back to work, and she's panicking about her bills, and we are able to get her a $50 gift card through Flex Funds tomorrow so that she can go back to work on Monday. So that quick response, I also think a lot of people really appreciate there's no judgment, when you're talking to people, and you're able to establish that relationship of trust. And we get back to people in a quick amount of time so that they can carry on with their lives and move forward as best as possible. So.
And similar to, as you said,
Yeah.
to all the rest of them, hearing is a theme, that what you just mentioned, that whole seeing them for the human beings that they are, that whole that Amy had mentioned from way back when with the community improvement workshops, which teaching that human component, that human-to-human touch is so critically important for them to be willing to then work with you and share with you and allow what they need to happen. As long as you're holding the microphone, Beth, what tools that you learned or were provided with during the ESPRI project helped you be more effective in your outreach to people in poverty?
Well, one of the tools was the group of the ESPRI members, because we got to know each other, we got to know each other's resources, and we were able to do internal referrals and really help people move forward. And I could call Wendy, or Wendy could call me, or Melissa, and we could say, well, this is what you could expect when you talk to, we could kind of give that information. So that was a big tool. Obviously the funding, the flex funding was a tool. We were able to purchase a cell phone for Success Coach. So texting people and giving that information and not having to have conversations all the time. We can keep them updated. Like I just did the referral for you, so you can expect to call this. That type of communication with people was critical, especially for people who are working and they can't really respond to things, or I just dropped off your food stamp application, so that they know what the next step is. That was really important. And I really think some of the, that was my pen. Some of the workshops, Amy mentioned, like the meetings, the monthly meetings that we went through, and some of the information we gained through those meetings was invaluable for me to, share with share with the people I was supporting. Like, did you hear that Enterprise has this deal, or the the credit union, that kind of thing. So all that collaboration and then that information is very helpful.
Great. Sean, do you have anything from Sharon about this one, that tools that helped with outreach?
Well, yeah, I mean, Sheridan put in there, and I have something of my own as well. But so he has one that it helped us partnering with organizations that we normally wouldn't have worked with as much. And he mentioned the Resource Center is one example, that normally we would associate them with OPWDD, but we developed greater relationships with their employment program, and our outreach with those living in poverty became stronger through them. But the one thing I wanted to mention was the flexible funding. I know for our participants, that has been a gigantic tool for us. I would probably say 80% of our people do not have birth certificates, did not have any form of ID, did not have boots to go to work if they were to get a job. And that gave us the opportunity to be able to quickly give them the tools that they need. I mean, even just to get something as simple as an ID, you have to have your birth certificate, and the majority of the people we work with when they first come in are homeless. So they just have what's in their bag. and it's not a birth certificate, it's not ID, it's none of those things. So being able to do that quickly and have the funds available is a gigantic tool for us.
Great. Wendy, I'm going to change it up a little bit because in the question. The tools you learned from ESPRI that helped either with outreach or with supporting and helping people with poverty. What was helpful?
Well, I think what has been mentioned, I just want to say ditto to all of that. We encounter a lot of the same scenarios. However, it was really nice, especially once the pandemic hit. We felt like we were able to act pretty swiftly, to know exactly what agencies to be able to reach out to specifically for different needs of the family. But also, creating the funding, helping individuals overcome those specific barriers so they can continue their education was crucial for us in their program completion. Oftentimes, their program of study at the college requires them to be, in person during the day, Monday through Friday, which oftentimes creates concern to understand how to juggle it all with just a single parent household. So a lot of the partnerships that we've created, the Women to Women through the YWCA, it helped our individuals understanding which agencies to reach out to, the funding especially, and connection to child care, more importantly for our single parent families. And the subsidy, the monies that was available also through the YW was extremely helpful. So it was a blessing to be able to work with the different agencies and to bring more awareness to light of what everyone is doing throughout the county.
And Melissa, same question. Tools that you learned during ESPRI that either helped with outreach and or support and your work.
Well, I'd have to say that I agree with everybody who's spoken on the panel. Same for JCLC, really. Working with Wendy, working with Beth, working with everybody in ESPRI was very beneficial. And to Tamu's question earlier, JCLC works directly with families and children at JPS, at the high school, and many of our referrals, although some do come from word of mouth or people who have been or had support previously in our program, referred to us, but many come from the Teenage Education and Motherhood program. So we work directly with them when they graduate from TEAM, get their high school degree, they come into our program. So that's where a lot of our outreach and referrals come from.
Great. So what do you see as the biggest challenges to or barriers? And we've touched on many of them with the presentation today. I think we've gathered a lot of evidence. From the perspective that all of you have, what do you see as the biggest challenges and barriers to obtaining and retaining employment for the people you work with?
I would say that, well, we know poverty is not just, it is generational and it's traumatic, but it's not only that, it's cultural. So when somebody is in poverty, they have their own set of social norms and social cues. They have their own language, essentially. So asking a person, a young mother in my case, to essentially switch tables, to transform her life is a very big challenge for her. I mean, imagine if I asked one of us to completely change your language and start speaking Latin in 6 months, right? Impossible. So getting her to realize that it is possible, she can do it, showing her how, opening the window a crack and allowing her to make the next steps. Sometimes it's a tug of war with the families because they want to keep their child safe with something familiar, and the unknown is very scary to them. So that is always challenging. I try as hard as I can to encourage them, but like you said earlier, they have to want it and be ready for it.
So Wendy, same question.
Yeah.
Biggest challenges, barriers that you have experienced?
Sure, and I touched on it a little bit, answering the last question. Is a lot of it, is not being able to be employed or having to stop working due to their program of study. A lot of my caseload is the individuals are in the nursing department. And so as a college, we are starting to recognize, and we're having conversations already to try to provide more flexibility for the adult population, so they can try to maintain and also obtain employment. Also working with the different businesses in the area too, to be able to provide skill sets for individuals leaving JCC and linking them to businesses for employment. But a lot for my single parents, like I said, it's depending on their academic program of study and the schedules. But I have had many recently who have gone out and obtained employment, which is great to hear. And now it's just a matter of working with them to juggle, and try to balance everything. So they are still feeling successful. The only other thing that I can think of is, I still have a lot of single parent families who will tell me they don't qualify for SNAP, which also affects HEAP. Or the significant other might make more money for childcare, and they cannot. There's too much stipulation, I think, for children or for individuals in poverty still, and I think we're still just trying to maintain how to work around those.
So and I agree with exactly what Sheridan said here, one of the biggest barriers has largely been systematic. So what we were saying about the benefits cliff earlier, that is a huge one. But also too, he mentions in here, if someone doesn't have employment history, future employment is difficult. And to kind of piggyback off what he said there, that is true. So when we're trying to help our participants get jobs, and if they've been homeless for many years or incarcerated or in facilities, it's very hard for the employers to understand those gaps. And that is, I think, just a huge problem with the stigma that goes along with people in poverty and people with substance use disorders, especially, that we deal with. They're not willing to hear the explanations. They're not willing to understand that. And I think that then is also a barrier for our participants mentally, because it's already implanted in their head that they're not going to be able to move forward because of the way they are viewed. That is a big barrier, and I think we do a very good job at trying to break through that barrier. But yeah, that's a really hard one for our people.
With SAFER, we supported people who were working, and the goal was just to keep them working. A lot of transportation stuff, like Terry gave the example of, making it affordable for somebody to have transportation to go back and forth to work. Childcare, the benefit cliff, all of those things come into play. People having the desire to want to continue to work and being ready to face those challenges. I think that was also a big failure, because it can be very intimidating. Feeling comfortable in the workplace and accepted by their supervisors and being able to talk to their HR departments openly.
So one last question for all of you, and this is a segue into the last section of this meeting. Summarized or bottom line, what would be a recommendation or two that you would make to anyone designing an anti-poverty program?
Some things that we had talked about was more, information for employers so that they can be more accepting of their employees and what's happening, and be more supportive. And I really think financial literacy is really important to include. I know that through this process I ended up taking a CRIC class and about home buyership, and like every person should go through that class, because they talk a lot about this stuff, about financial stuff, and I think it makes the whole thing less intimidating because there's supports. So that's what I would say.
Well, it's just kind of funny because I'm reading Sheridan's answer and it's things I've already said. He says, I would say that addressing systematic barriers is equally as important as addressing personal barriers to economic survival and thriving. I know that this is a larger question, but if advocacy and policy development isn't a part of the program, we are missing a huge piece of why poverty exists generationally and placing all responsibilities on those with little to no power. That is one of the most passionate points. Do not allow blame to rest solely on the disempowered. And I agree with that 110%. I've said it a couple times now. It has to change at a higher level before anything is going to be accomplished for people. It just is.
I know I enjoyed the monthly meetings that they provided and it provided a lot of more collaboration, but maybe even having time to discuss or share current struggles that maybe your program is currently going through. I feel like sometimes I exhaust the same, resources over and over again, and I know that there's always new and evolving agencies and resources that are out there. And so that was one of the things that I was thinking. I liked how Beth had mentioned, providing the workshops and the financial literacy. Maybe even just thinking, and I know time is crucial for everyone, especially for my single parents, but maybe even trying to get all of our partnerships with their caseload together to provide maybe things like that, rather than just program by program trying to do the same thing. That's all I had.
Financial literacy, absolutely. John, you've been very helpful in that regard for our program. We need more of it. Budgeting, what to do with your income tax when you get that large sum of money. Also, allowing time. I mentioned it before, but those total transformations, not just like a solution to that immediate problem, which is also very helpful, but like a total transformation takes time. It's not something that happens overnight. I would also say to extend the services countywide. A lot of the barriers lie in rural communities, internet access, transportation, access to agencies and things like that. Transportation is huge in the country. Obviously, we've said it a million times, flexible funding. Funds will be needed for things like identification, whereas birth certificate used to cost $10, now it costs $30. A waiver would be nice for a road to employment. Transportation, how do I get to work? Clothing for work, you mentioned before, boots. Go to work at a factory, you need steel-toe boots. So the road to employment is full of barriers in itself, so flex funds are very helpful for that.
Great. We are going to transition to another exercise, but does anybody have any questions for the panel? From what you've heard, we've tried to cover a number of different ways of looking at all this. Okay. Hey, great job, everybody.
Thank you. so eloquently. Do you just want to share your thoughts? No, okay. What did we learn? So we talked a lot about businesses in our community and the business model and how the business model needs to be a more accurate representation and reflection of our community. So we talked about flexible hours. We talked about human capital, not physical capital. Too much time on the business itself rather than the worker, because without the worker, there's no business, right? Job training, you need mentioned. Need more awareness and advocacy for the navigation of systems that we had talked about earlier. What else did we had a lot of thoughts going on here at once, but I think I kind of covered a lot of them. Do you want to add anything, Andy? Yes, I know you.
My group unfortunately had to listen to me vent about the benefits cliff. And the benefit cliff has multiple layers because we pay people to do things that are destructive to their long-term success. For example, you only are eligible for emergency HEAP if you have a termination notice that destroys your credit rating, that makes it higher for you to borrow, that then raises your interest rates and your costs of living. We pay people not to get married, because if you're married, 100% of both spouses' income is considered for benefits, but if you're not married, only the child support that's paid by the absent parent is considered. And so, unfortunately, all those, I have legislation addressing those issues, but it's very difficult to get a different mindset about how we need to change our system to make it easier for people to leave poverty rather than stay in poverty, which is the fundamental issue on the benefit cliff.
Who would like to go next?
Let's just keep going around this way.
Okay.
And we especially want the answers to the next steps. What'd you come up with?
For our next steps, I think that right now might be our best opportunity. We're facing some pretty scary times in the next couple months if we have a lot of agencies that are going to be losing staff due to the vaccination mandate. If we target the agencies and help them, like they were saying, focus things that are based on the workers' needs, people are going to be desperate to get staff to work and be motivated to stay at their agencies. So using this time now, I think, might be beneficial.
So now is the time.
I think so.
Okay.
The only other thing that we talked about is having the people who this affects at the table. So before we make decisions, people in poverty or people losing their job, they need to be at the table. Right.
So one of the things, and I thought was interesting because it was almost contradictory to what Melissa was saying, but when she said focus on the person more so than the business, but we had said we need to put some more emphasis on the business because there is a lack of understanding with their workforce, and until we get them to understand some of the challenges, they're going to continue to, terminate somebody because they met their points or, whatever it is without understanding the whys. But then we talked about really needing to have some funding, and perhaps some of the federal funding that's coming in now would be the time, much like they said, to invest in that, because many of these programs don't have other funding mechanisms. So these programs will come to a screeching halt after the last few years of being able to provide the service. So now would be a good time, and that we would do some more deliberate collaboration, knowing what we know now and the relationships that we formed, so that when there is some of the turnover that Amy talked about, and we talked too, like there's been a lot of turnover within the businesses as well. So not only within the provider agencies, but all of the 14 businesses we worked with had turnover in their HR departments. So it was a constant re-education of the program and the supports, but that we could support each other. So if Community Helping Hands didn't have somebody at that moment, the Resource Center could help them, and we could partner together so that the services didn't have to come to a screeching halt, and we could work with each other more than each provider doing their own thing. And so being more deliberate with that, but really needing to find a new funding mechanism so these programs don't just completely go away, because people have really become to rely on them.
Great. Oh, man. Microphone is coming. Okay. I
you know, we talked about the benefits cliff, but to support our public officials, it was also mentioned that a grassroots effort needs to happen around the area of advocacy in general. We can go to our, and I'm a public official at a smaller level, but I know Andy and probably George would say the same thing, is you can ask us to do some things, but we need some support. And so really forming some sort of grassroots, either through this organization or this probably is the best way to do it, to really start to get advocacy, to be able to increase the voice and engage the stakeholders who are recipients of the programs that we serve, as well as people who are working in the programs and understand what some of the challenges are. So we have a united voice as a group to begin to push for change at the state level. So that was one thing that was created. We have a significant transportation issue here, and it was mentioned that you know, the Empire State Development Area or organization, whenever John would speak to them, that, you know, well, your prices for counseling are so low, and he says, well, yeah, if you want to live under a blue tarp to be able to pay for your you know, because you can't get there. And so looking at some of these agencies that have funded really nice programs, like they did do some funding on economic development with the Comedy Center, but really asking them to kind of review some of their policies, because policies can be reviewed and voted on and reenacted, and people should be looking at them all the time. And so when we start talking about policies, can we begin to look at some of these state agencies to really come down to Jamestown and not just look at whatever data is out there, and really talk to the people to kind of understand what some of our needs are. And then, let me see, transportation, and this was something I kind of mentioned to the mayor, and it was mentioned in the community foundation, so I don't know what these monies could be used for, but there was a person that stood up at the council meeting on Monday night who really talked about not only he didn't really talk about interagency collaboration, he talked about intermunicipality collaboration. Every municipality received funding. And so everybody, I would wager that everybody's kind of looking internally about how can we protect our people. But you have people who don't live in Jamestown who work in Jamestown, and you have people who work in Jamestown, or the other way, you know, work someplace else who live in Jamestown. And so how could we work with the county or other municipalities to better leverage some of these COVID funds to address maybe the issues of transportation, or maybe some of the other things that funding has become a problem with? And so I really believe that that's something we need to kind of engage in before we really start. You've seen the Lakewoods and the towns of Ellicott and things like that, who have people in poverty out there, spend their funds on things like that. And the one thing that I would like to say is maybe with the agencies, and they talk about the turnover, or any businesses with turnover, really maybe explore the recruiting and hiring practices. And by that I mean, for example, we have a lot of people who are retiring who are educators and teachers and things like that. My mom's retired and she wants to work. Could we start to look at different ways to, you know, and some of them just want to be out and about and engage with people. Can we start looking at different ways to employ some of our retirees, and maybe part-time? Maybe they don't need benefits because they already have good insurance and things like that. So I think it really behooves us to be very creative on what hiring and recruitment looks like.
Thank you. Let's move back to whoever the scribe was back there. We got you waiting? Yep.
Okay, so the topic of mentoring was brought up, and that perhaps these individuals, upon entering any new environment, should be set up with a mentor to help them facilitate and work through the areas that are all so new to them. Another idea was providing a key agency to help and maintain data collection as a whole, to make sure people are collecting accurate and most updated data for ESPRI. As far as next steps, who, when, and how, they talked about maybe providing a poverty coordinator. You know, there's a lot of money out there that is given out to poverty, but perhaps maybe they can find something, a grant for providing a poverty coordinator to meet with agencies to continue the spirit of what ESPRI has already started, and maybe to look at other areas or cities to see what they do, and when, as soon as possible, and how, you know, possibly looking into additional grants.
Great. Okay, if you want to pass the microphone over to Linda. Okay.
Yeah. Next steps, still agreeing with the idea of advocacy for policy change. And we thought maybe we should be starting with our own county, who has a great deal of flexibility on how they distribute funds to the agencies, and maybe there's a less complicated way to do that. How we could set up flexible funding for the agencies, which was resoundingly one of the lessons learned. Could it be through how the county gives out their agency grants, or encourage? I know from a funder standpoint, we generally give operating grants, which gives them flexibility, but no one's ever put it in their budget. So I would say to the agency, start putting that in your budget so that when you apply to funders, they see it, and I don't think there'd be any pushback. So, yeah. Speaking as one funder, right? Yes, speaking as one funder, and many, yeah.